Hello, everyone. I have Loaiza, Dr. Leo Loaiza. He is an ER doctor from Texas. Leo, thank you so much for talking with me today and taking some time on a Sunday. I know you're very busy, so I'm happy that you set up some time to do this with me.
No, thank you. It's my pleasure.
Okay, and if we can just dive right in, tell me a little bit about your perspective on what's going on and what you're seeing at the hospital that you're working at.
Well, right now in Texas, we haven't been hit as hard as the Northeast, fortunately. However, when we watch the news and we talk with our peers in the Northeast, we realize that things are bad. So we are getting prepared, and just doing the preparations, you can see the greatest, the best of people, and also the worst. And this is quite an interesting dynamic. So we're still ironing some little things that we have to polish before we get hit by a storm. So
Yeah. And can you explain a little bit more about that? What do you mean by seeing the best and worst of people?
yeah, people have come up with solutions, with plans, with excellent planning strategies, um, coming all together, allowing other people to participate, acknowledging that everybody has a role in this. Others want to just hold into the power of this is my turf, and this is what I'm going to do, and this is going to way it's going to be at. And others have been reacting as hiding or just avoiding, and I don't want to be part of this, or making up excuses, A, B, C, D, I can't, and it's totally understandable. People have different backgrounds in terms of other experiences like this, but I don't think that anyone has ever experienced something like this anyway. So
Yeah. And what are your thoughts on stopping the spread, and what are your thoughts on this and on the virus from what you know from, your education and background?
well, I understand that a lot of people, and this is kind of understandable mechanism of uh, uh, defense, I guess, that is, this is not going to come to us. We're not going to get it. This is United States. We're talking with that in China. Now that is here in our country, and we're getting, we're the first ones in the world at this point. Now people see it a little more real, but it's still, some of them still keep thinking, oh, this is my town. This is just too small. This is not New York. This is not a big city. And they keep having this avoidance. And it's absolutely real. We got to stay at home. We have to have this social distancing that is very difficult for a lot of people. And I understand that. I'm a hugger, and for me, it has been quite difficult, all of this. As a Latino, for me, contact is very, very important. And being close with my family and everything is very difficult. I understand that part. But this is the most important step, the most important step. Um, I don't know if that answered the question, but yeah.
Yeah. Thank you so much. I appreciate it. And then currently right now in the ER, what trends are you seeing as far as patients coming in?
Oh, that's an excellent question. So we prepare for this a little while. So we were expecting a surge of patients, and actually happened the contrary. Here, people are staying at home. They're avoiding to go to the hospital. So we've seen a low in patients, the number of patients going to the ER. A lot of offices are working online, having virtual visits, and that helps a lot. So we are kind of surprised not having the same number of patients in the ER, but we are waiting that this is going to change. This is just kind of the quiet moment before the storm. We are aware of that. That happens to other hospitals too.
I see. And then have you had any cases near you?
Yes. There are some people at the hospital. We don't have bad cases yet in the hospital. In town, we have 30 plus cases so far. and no one in the hospital that is in critical condition until last night. I don't know exactly what happened since the morning. Um, it is my understanding there might be a couple of health providers that might have gotten infected by other means, not health care related yet. But this is just the beginning, so we'll see. Of course, we have been with a lot of potential cases that we have to see and examine and dress up and do all these things, taking the samples and then them back home and everything. But so far, not the ones that we fear the most, which are the ones who are in acute respiratory distress and we have to go and intubate.
Okay. And then what are your thoughts on who is at most risk for severe symptoms?
Everyone is at risk, and the famous phrase of "oh, this is only for people that have comorbidities and are old" is no longer true. My friends in the Northeast are telling me about perfectly healthy 16, 30, 40-year-old people are getting the disease, and have died of it. So yes, of course, the older and the sicker you are, the worse it's going to be. Yes, but it doesn't mean that only those are going to get it. So we all have to take this responsibility that I might have it, even though I feel great today, and I have to take this responsibility of not being close to other people because I might pass it on. And
Right.
in a way, the same way is my responsibility to avoid that other people that I don't know to be closer to me because they might have it. It's unfortunate, but that's the way it is. Obviously, to answer the question, sorry, I got distracted a little bit. Um, the most I have to take care of are the ones who have comorbidities, mostly the ones who have cardiovascular disease. It seems like those are the ones who are at higher risk, um, and they're over 70 years old. With cardiovascular disease, those are the highest risk. Not to catch it, it seems like the risk is the same for us, but to get it in a severe way, those are the ones who are high risk.
Okay. Thank you so much. And then also, how long have you been practicing in emergency medicine?
I graduated in 26 years. Yes,
Okay.
26
Great.
years.
Okay. Well, thank you so much. I really appreciate your time. Any other thoughts that you want, people to know, or what you're seeing as far as other healthcare providers? Any advice you can give?
Yes, I think that behind this pandemic, the other pandemic is the panic and the fear um, from the general public and also us as health providers. We are glued in our iPads and computers. As a health provider, I read up most of the articles that have come up in the good journals, and there are a lot of good articles that we have to also learn to take with a grain of salt and pepper. You have to see what conditions the article was written. Usually, it portrays cases from particular hospitals and countries. There are several good articles as well that has help us to illustrate what the reality is, and we have to keep that in perspective. But panic doesn't help. If I fill my mind only with the negatives, um, we are not going to have a good time in this. I mean, this is not a time to have a good time. Sorry to put it in that way, but it's just that we won't be able to overcome this in the way it should be. We have to see beyond this, and we have to come together. We have to follow and learn to follow the advice of people that knows. Ignore the ones who don't know about this, and just start expressing their own opinions, and learn to do other positive things. Take the time to be with your family, cook. We cook together, we eat together, we watch movies together, and that's kind of a way to help to remember that there is a lot of positive things around you, and that's the way we can win this. That boosts your immune system, that gives you the endorphins and the energy to be present, and this is the most important part. uh, Unfortunately, in Italy died 50 plus doctors and healthcare providers. Spain is the same. We had already a few health providers dying in the Northeast. That's very unfortunate. And this is the most important thing is to be present. Every time you're going to do something, be there and do that. Take the steps to protect yourself, use your PPE, and be able to treat that patient. And once you're at home, forget that you're at home and be present. I think that that's going to help us in the
Thank
long
you
run.
so much. I appreciate it. And then one other thing, I've talked to a few other ER docs who've been working 14 days in a row, 14 hours in a row. Any advice for them and helping them with maybe burnout?
Yes, as I said, right now we are actually with lower numbers, but we have been using this time to kind of split shifts in such a way that we can send people home and rest. But we are all aware that this is going to change in a couple of weeks, week and a half, and we're going to probably do extended hours. So eat well now, sleep well, very important. And again, be present at work. We can't afford to just keep something in our minds and keep calling home to check for things that is not in our hands. Make sure you have someone at home that can help you out with those things, so you can be present at work. That's what I think. Yeah.
Okay. Thank you so much, doctor. I appreciate your time.
So this is what we do in our medicine. That as a naturopathic doctor, what would you advise to your patients when I ask you the question, what can I do to, aside of being, secluded, be in the home and stay home, what other things can I do?
Yeah. Well, there are a lot of ways to help boost, and not so much boost because you're not really boosting your immune system, but supporting and strengthening your immune system. And there's a few things that we can do. Obviously, whole foods, good nutrition is essential because the immune system requires key vitamins and nutrients in order to function. In order for us to process and digest and absorb these nutrients, we need certain key vitamins like magnesium and vitamin D and vitamin A. Another thing is making sure that our liver is functioning well. So this means, not overburdening it with alcohol and processed foods that inflame it. Things like that, lifestyle factors that you're doing each day. Our daily habits create our health. And so if you're doing things every day that are inflaming you, this is going to also inflame, the immune system and the lungs. And this is something that we need to preserve and protect right now. And then also, like you had said, being present, reducing anxiety and stress, which weaken the immune system, doing things like meditation and yoga and exercise are just so important right now in helping preserve your health, and not just your physical health, but your mental health. So I think just doing that, and like you said, really being careful to mind what media you are consuming, and making sure that whoever you're following is not provoking anxiety in you. And making sure that they're credible sources, and they have facts, and they have research and evidence, with whatever it is that they're theorizing or concluding to. I think those are the most important things. I mean, really, as a naturopathic doctor, I really teach people to get back to the basics, get back to nature, being outside, getting fresh air, going for a walk, going for a jog if they can or able. This all is going to help their physical and mental health and strengthen their immune system. And really getting back to the basics is what I'd recommend, and really focus on, and trying to not eat things that are processed or man-made that aren't alive, things that don't have a lot of vitality and energy. So that's what I'd recommend.
That's good. I totally agree with that. Exercise is very, very important. That's very important part of my life as well. And I think that what keeps me alive and good.
Yeah,
I don't know
absolutely.
about coffee, but I drink a lot of coffee. I was born in Colombia, so I have to drink a lot of coffee.
Well, that's okay. That's okay. As long as the intestinal stomach lining is, your barrier is intact and it's not inflamed, that's That's all that matters.
Yeah,
I think coffee can be so beneficial. However, if someone's anxious or naturally tends to be,
yeah, no,
anxious, I don't recommend it.
that that is true. That is true. What your thoughts are about licorice?
Licorice. Licorice is a wonderful herb. It helps strengthen the immune system. However, licorice can also stimulate blood pressure. And so,
Mm,
I think it's very important to always take supplements or herbal medicines that are individual to you and your health history, and not to just take a bunch of supplements just because they are, recommended to boost the immune system. But licorice is fantastic. It's really great at supporting and strengthening the whole body.
yeah, I read that they have some studies in vitro, not in vivo, uh, um, with licorice killing some of the coronavirus. Not this one in particular, because that we didn't know existed,
Hmm.
but other coronaviruses,
Yes.
and they showed to be pretty effective. And the other thing that got my attention is that it was part of the recipe of a little soup that the patients in China were given,
Hmm.
and it has licorice in it. So it's kind of cool to know that.
Yes, it really is. And I was reading an article. You might find this quite interesting if you're looking for natural ways to help with the coronavirus. In China, they have come up with potential interventions for the novel coronavirus. It was a systematic review from the Wiley Online Library. And it was published in the Journal of Medical Virology, I want to say a few days ago, or maybe in the past month, with dealing with this. And some of the things that they had recommended were vitamin A, B vitamins, vitamin C, vitamin D, vitamin E, omega-3 fatty acids, selenium and zinc, and iron. And then they talked about immuno enhancers such as interferons, intravenous gamma globulin. It was, I think, thymosin alpha 1. And then also there was a few other things like cyclosporin A, and then there was also some other like protease inhibitors that can help with specific treatments for coronavirus. And they were talking about some chymotrypsin-like inhibitors. I don't know if you've heard of any of those, and like papain-like protease inhibitors, and of course the ACE2 blockers. They're looking at all of those as treatments um, for the coronavirus.
Yeah, they're very interesting things there. No, about the protease, I haven't heard about those. Um, the most successful treatment until now, it seems like it's the corticosteroids with chloroquine and some combination of antibiotic, doxycycline or azithromycin.
Yes.
Those are the ones that have been kind of being used in the hospitals in the ICU. I heard about some cases in California overdose of these two because they prolong the QT in the EKG, so you get more prone to tachycardias, or VTAC or VFib. Obviously,
Mm.
those can kill you. And oh, California experienced some problems about that. Nigeria also had several cases of intoxication after Trump announced that, oh, chloroquine is an excellent medication for all of these and it's going to kill the virus. And no, that's not true. It's, it's, it's not going to kill the virus, but it helps, seems like.
Mm.
Yeah.
I see. Another thing, and I don't know if any of your friends in the Northeast have talked about this at all, but I did see just recently that vitamin C intravenous therapy was being used.
No, I didn't know that. It's interesting. I'm going to look into that.
Yeah, so
That's
they're
cool.
using that. They've been using it in China as well. So yeah, I would definitely look into that as well.
Okay, that one I'm gonna look for sure. That's interesting. I like it. Yeah,
Yeah, yeah.
that's
Anything we
good.
can do, right, to save
Yeah,
lives. Yeah, well,
please.
thank you so much. I really appreciate it. And I hope you have a wonderful day and you and your family stay safe.
Thank you, Cece. Take care.
Bye bye.
Bye.